we've moved a lot towards tranexamic acid. Now, tranexamic acid is a very interesting medication. It's traditionally what we call an antifibrinolytic, which is designed to help people clot their blood better, essentially. So it's mostly used for patients that are bleeding in surgeries or post-childbirth, and also used very commonly for women who have very, very heavy periods because they're prone to bleeding too much. Now, what happened was that women who were taking this tablet during their period cycle every month noticed that their melasma was getting better. And a great medication, generally very, very low risk, although we would recommend doing screening to make sure that you're not overly prone to blood clotting before we would use tranexamic acid. And so that is often used as an oral agent to help melasma. So how does it work? We don't 100% know, but it seems to affect the inflammation, so sort of plasmin-mediated inflammation in the skin, and potentially reduces the vascular growth factors in the area. And they, as I said before, it's kind of this vicious cycle that causes melasma of these sensitive overactive melanocytes, but these, the increased vasculature, increased hormones, and this sort of vicious cycle of everything contributing to the pigmentation. So if you can cut back on the cause of the triggers, then that's how tranexamic acid seems to work, that it's actually down regulating the inflammation that drives the melanocytes to produce pigment, versus hydroquinone, which is kind of stopping the melanocyte from doing its little job. My preference generally is a shorter course to get things as good as possible of topical hydroquinone and oral tranexamic acid together. And then for maintenance, I'm transitioning to topical tranexamic acid and retinoids.